Hello everyone, welcome to nursing tutorial. Today we are going to discuss about blood pressure. It is the fourth part of vital signs. So let's start our today's topic. What is blood pressure? Blood pressure is the force exerted by the blood against the walls of the blood vessels as it flows through them. Normal blood pressure in adults is 120 per 80 mm of Hg. Next, systolic blood pressure. It is the highest degree of pressure exerted by the blood against the walls of the blood vessels during the ventricular systole. Next, diastolic blood pressure. It is the lowest pressure that occurs when the heart is in its resting period, just before the contraction of the left ventricle. Pulse pressure. It is the difference between the systolic and diastolic pressure and represents the volume output of the left ventricle. Next, hypertension. The blood pressure above 140 per 90 mm of Hg is called hypertension. Hypotension. The blood pressure below 90 per 60 mm of Hg. It is called hypotension. Next, primary hypertension. It is happen without a known cause. Secondary hypertension. It is one which is associated with a known pathology. Next, orthostatic hypotension. It is a low blood pressure associated with weakness or fainting. Means when the BP is decreased suddenly on standing posture, it is called orthostatic hypotension. Next, factors causing variations in blood pressure. First one, age. Blood pressure is lower in children than in adults. Pressure gradually increases until 45 to 50 years. Second one, sex. There is no difference in blood pressure values between boys and girls until puberty. Means after puberty, females usually have a lower blood pressure than the males. Third one, body build. Blood pressure is higher in persons with overweight than in persons of the same age with normal weight. Fourth one, race. Black people will have higher blood pressure reading than other races. Climate. Pressure norms are lower in tropical climates than temperature and highest in polar climates. Next, time of the day. Blood pressure is lowest in the early morning and then rises to a peak in the evening. Next, exercise. Muscular exertion will rise the blood pressure. Pain. Severe pain increase the blood pressure. Emotion. Fear, excitement and other emotional factors will raise the blood pressure to greater level. Posture. Blood pressure is lower when laying down than when sitting or standing. Disease condition. Disease affecting the circulatory system and kidneys may increase the blood pressure. Next, drugs. The drugs such as nitroglycerin cause a decrease in the blood pressure. Hemorrhage. Hemorrhage causes a low blood pressure by decreasing the volume of blood in the blood vessels. Increased intracranial pressure. Pressure in the cranium usually produced a rise in the blood pressure. Next, instrument used in measuring the blood pressure is called sphygmomanometer. Here we can see three types of sphygmomanometer. First one, Android sphygmomanometer. Second one, mercury sphygmomanometer. And third one, digital sphygmomanometer. Next, cuff size according to age. Newborn baby, cuff width 3 cm and cuff length 6 cm. Infant width 5 cm and length 15 cm. Adult 13 cm and length 30 cm. Adult height 20 cm width and length 42 cm. Next, sites of taking blood pressure. First one, upper extremities. Here apply the deflated cuff evenly with rubber blender over the brachial artery. The lower edge being 2 inch above the antecubital fossa. And second one, lower extremities. Here apply the cuff just above the knee or above the popliteal fossa. Next, contraindication. Do not take blood pressure if the client's arm, first one, the arm has an intravenous infusion, means IV infusion. Second one, the arm is injured or diseased. And third one, radical mastectomy. It is all about blood pressure. Today we complete our vital signs chapter.